My name is Dr. Chidima Ibe, and I'm with the Johns Hopkins Bloomberg School of Public Health. I'm pleased to be here today with Dr. Lisa Cooper, who is the director of the Johns Hopkins Center to Eliminate Cardiovascular Health Disparities. Good morning, Dr. Cooper.
Good morning.
So my first question to you is, what are health disparities?
Health disparities are differences in health that are experienced by groups that are typically disadvantaged socially or economically. And that includes African Americans and Latinos, as well as people living in poverty, and there are other groups as well.
Do we have health disparities here in Baltimore?
Definitely. Sadly, there are. So just within a 5-mile radius, there are huge differences in health in Baltimore City. So if you just look at Roland Park and you compare that to where we are right now in East Baltimore, there's a 20-year gap in life expectancy. So that means that in Roland Park, you can expect to live to be 83 years old if you live there. But if you live here in East Baltimore, you could expect to live on average to be only 63 years old. So huge difference, and in large part because of differences in rates of heart disease. So the rates of heart disease are twice as high in this area of the city, and just 5 miles away, about half the rates.
What explains the differences in health disparities among African Americans than other racial groups?
There are lots of different reasons why the rates are different. For one thing, we know that the neighborhoods in East Baltimore have higher rates of poverty. There are more African Americans living in East Baltimore. We have less access to healthy fresh foods here in East Baltimore than we do in Roland Park, for example. So there are lots of reasons for those differences, but in large part, it is because of these differences in heart disease and stroke death rates. There are other reasons like, diabetes and, even like crime and homicide, but heart disease is a major contributor.
What is hypertension, and how does that contribute to heart disease and stroke?
So hypertension is a condition where the blood vessels, are experiencing a lot of stress due to the higher pressure of blood flow through the vessels. So hypertension is the number one contributor to race differences in heart disease, because in the African American community, rates of hypertension are higher than anywhere else in the country and in the world, actually. So that's what hypertension is. You measure it by going to the doctor or by going to the drugstore, and you could actually come to a blood pressure screening at your church, which I understand that there are going to be some of those this month, and you can have your blood pressure measured. And there are two numbers, an upper number and a lower number. Upper number is called systolic, lower number is called diastolic. We like to see the numbers being 120/80 or less, and that's normal. And then anything between 120 and 140 is sort of in the pre-hypertension range. And then people who have high hypertension actually have blood pressures that are 140/90 or higher. And at that point, we really recommend some sort of treatment.
For people who have hypertension, what can they do to improve their health?
So if you already have hypertension, it's very important for you to go to see your doctor when recommended. Take your medications. A lot of people who have hypertension need to take 2 or 3 medications in order to get the blood pressure under control, but that's okay. The medications are safe. They work well. They work equally in African Americans and other groups. And the other thing you can do is to maintain a healthy lifestyle. So be physically active. That means take walks at least 20 minutes a day. You can eat healthier, so try to eat fresh fruits and vegetables whenever possible. You can cut back on your alcohol intake, so don't drink more than a couple of drinks per week. And maintain your weight or lose weight if you're overweight or obese.
Dr. Cooper, for those of us who don't have hypertension, what can we do to lower our chances of getting it?
So if you don't have hypertension, that's wonderful, and you're very fortunate. But you can do a lot of the same things that people with hypertension do. but focus on lifestyle, because luckily you don't need medications yet. So what you can do is to, again, be physically active every day. You can maintain or lose weight if you need to lose weight. You limit your alcohol intake. And you also try to manage your stress. So, we all have a lot of stress. What I would say is don't take on more than you can handle. Mm-hmm. Ask for help and support from your family, your friends, your coworkers, your church family when you need it. And offer that support to other people too, and be a good example, and go to see your doctor once a year.
Well, thank you so much for your time and for giving us such helpful tips about how to take better care of ourselves and to lead a healthy life.
You're welcome. It's a pleasure to be here, and I hope everyone takes care of their hearts and has a wonderful Valentine's Day.